Hello everyone, welcome to sqadia.com. And in this section of our lecture, we will talk about the heavy menstrual bleeding. When we will talk about the heavy menstrual bleeding, we will talk about the causes of heavy menstrual bleeding and what are the effects on the patient of heavy menstrual bleeding and what are the different investigations done to rule out the cause of heavy menstrual bleeding and what's the management to control that bleeding. So first, what are some causes and effects of heavy menstrual bleeding? Heavy menstrual bleeding, also known as menorrhagia. Before, this term was very commonly used for heavy menstrual bleeding, menorrhagia. But now, instead of using menorrhagia, mostly just in the medicine or in the gynecology, the new term is heavy menstrual bleeding. It's a very common disorder. About 20 to 30% of the females have this problem, and with each cycle, females who have this problem they lose about 80 milligram of blood. So it's a lot of blood loss in females with heavy menstrual cycles. Mostly the causes of heavy menstrual cycle or heavy menstrual bleeding is fibroids, adenomyosis, PID. PID stands for pelvic inflammatory disease, coagulation disorder, thyroid disorder. Warfarin is the drug used, that's a blood thinner, also cause heavy bleeding, endometrial and cervical cancer. So these are all very common causes of heavy menstrual bleeding. Among these, coagulation disorder, pelvic inflammatory disease is very common. Females who have infections, and those infections sometimes leads to different adhesions, and this can in turn lead to the heavy menstrual bleeding. Fibroids is another very common cause. Lot of females in the reproductive age develop fibroids. Fibroids are smooth muscle cell tumors, and with the hormones estrogen and progesterone, fibroids grow. Sometimes during pregnancy, lot of females develop fibroids too, and those fibroids start bleeding along with the pregnancy. And if the fibroid is not obstructing or causing problem for the growth of the baby, usually the gynecologist let it grow, and then after the pregnancy they decide what to do with the fibroids. In some cases, after the delivery, when the hormones go back slowly to the normal, fibroids they regress or they shrink, so no treatment is required in most cases. Then adenomyosis again is the growth of the endometrium into the muscle layer, and that causes thickening of the layer of the endometrium, that also cause heavy menstrual bleeding. Since a lot of blood is losing, so the common symptoms that patient develop is they are very weak, they are tired, they have shortness of breath because blood is lost so much that oxygen supply to the body is affected. So shortness of breath is very common because of lack of supply of oxygen to the tissues. Then there is skin is pale. Pallor of the skin is again very common because of anemia, low hemoglobin level. Tachycardia. Tachy means fast. Cardia is heart. So heartbeat is very fast. To overcome the deficiency of hemoglobin or oxygen deficiency, the heart start pumping very fast, so the blood supply to the body should be good enough. So all these are very common signs and symptoms of anemia. Anemia is due to deficiency of hemoglobin, which carry oxygen to the body, and this is all happening because of the blood loss from the body. Then some investigations done to find out what are the causes of heavy menstrual bleeding and what are the consequences of heavy menstrual bleeding. CBC is complete blood count. Complete blood count is done to find out the hemoglobin level, which is because of loss of blood supply. Hemoglobin level is very low. If hemoglobin is really very low, sometimes blood transfusions are required. So it's important to do complete blood count in patients with heavy bleeding. Then coagulation screening is done to find out if there is any deficiency of clotting factors, and if those are deficient, then again we need the transfusion of clotting factors also. Pelvic ultrasound. Pelvic ultrasound is done to find out any fibroids, any growth, any adenomyosis, or that's the cause of the heavy bleeding. Then high vaginal or endocervix swabs. These swabs are taken to rule out any infection which is present. Infections can also lead to heavy menstrual bleeding. Then endometrial biopsy. Endometrial biopsy is very important in endometrial hyperplasia. Even menopause, after menopause, when the regular menstrual bleeding is or regular menstrual cycles are stopped, sometimes bleeding occur, and that in that case usually the hypertrophy of the endometrium is present. To find out any serious cause, to rule out any endometrial carcinoma, usually endometrial biopsy is done. And if the biopsy shows no cancerous changes, it means there is simple hyperplasia of the endometrium. Thyroid function test. Thyroid is very important, especially the low thyroid levels with no ovulation taking place, with infrequent cycles. The heavy bleeding occurs when patient bleed after 2-3 months. Bleeding is very, very heavy. So thyroid function tests are also very important. Then also another test to rule out is laparoscopy, in which the laparoscope is inserted into the abdomen, and then the doctor can directly see if there is any endometriosis, if there is any adenomyomas, if there is any fibroid or any other changes. So that's the laparoscopy. Here you can see this is the ultrasound of the pelvic ultrasound. In the monitor you can see any growth or anything. In this is the endometrial biopsy. With the curette, you just take the small tissue out and then send it to the lab for the biopsy. And then you can find out whether there is any cancerous growth or just the simple hyperplasia of the endometrium. Then what's the management of heavy menstrual bleeding? The management first is LNGIUS. It's called Mirena. Mirena, LNG is levonorgestrel intrauterine system. Levonorgestrel IUS Mirena. Here in this picture, if you see, this is the Mirena. This is inserted into the uterus. It releases the progesterone, and then constant release of progesterone bring the tissue back to the normal. This is very important for endometrial hyperplasia. So this is the Mirena, LNGIUS. Then the other treatment, some medicines you can use is tranexamic acid. That's it prevents the breakdown of the clots. Tranexamic acid breaks down of the clot is prevented. When the clots are broken down, it leads to more bleeding. So it prevents the breaking down of the clots. Then we have mefenamic acid. This is like non-steroidal anti-inflammatory drug used for the pain, swelling, and discomfort. And oral contraceptives, again, very helpful in regularizing the cycle and bringing the bleeding down. Then the other treatment is progestogen for starting from day 6 of the cycle to 26th day, 15 milligram is used. Then endometrial ablation. Endometrial ablation, if you see, it's the microwave. You can burn the endometrial tissue by these waves. So endometrial ablation destroys the endometrium. Heat is applied which destroys the endometrium. This is not a very preferred treatment or management in patients who want to become pregnant afterwards, because sometimes it causes damage to the endometrium. So endometrial ablation is the heat is applied to destroy the endometrium tissue. Then the other is hysterectomy. Ectomy. The word part ectomy means removal. Hystero is used for uterus. So hysterectomy is the removal of the uterus. If patient is menopausal, or if the family is complete, they don't want any more children, hysterectomy is sometimes required if the excessive bleeding cannot be controlled by other things. So in this section, we talked about the heavy menstrual bleeding, and we talked about some causes of the heavy menstrual bleeding. We talked about how we can investigate and how we can manage those problems. Thank you for watching sqadia.com.